Welcome to the podcast series Inclusive Research and Innovation in Science, Technology, Engineering and Mathematics. My name is Claudia Werker and I'm an associate professor at Delft University of Technology in the Netherlands. I host this podcast series on RE in STEM. Today, I'm happy to welcome Dominico Della Volpe, who is professor of physics at Geneva University in Switzerland. Domenico and I have been working on an EU-funded project called ATTRACT. Domenico has been on the engineering side of the project, particularly working on radio-guided surgery and nuclear medicine. In contrast, I have been on the social science side of things. What I will discuss with Domenico today is not only his project, but also how working interdisciplinarily might contribute to ideas regarding inclusive research and innovation. Perhaps, Domenico, we start with you telling us a bit about your professional background and your research and innovation activities.
Thank you, Claudia. Well, I am a particle physicist as a background. In recent years, I've become more interested in astrophysics, but I'm mostly interested in instrumentation. Honestly, I consider myself what we call an experimental physicist. So based on that, I always work on technology somehow. And with that track, I finally got the chance to bring forward and bring to, let's say, reality an idea about some new medical device for radio-guided surgery, what you just mentioned. The idea is that the way also to use your background, your know-how, with someone that has a much higher social impact than basic research as we usually do. That I think it's important as a very indirect social impact. People do not realize that basic research is culture and brings people, but in this case was just for myself, something that I would like to do. So the project was in the framework ATTRACT. It's for a new medical devices. The idea is that this could help the surgeon during surgery using what is called radio tracer. When you do a scan, usually it's called also mean of contrast for people, ordinary people. When you go for a PET or for a scan, they inject you this liquid that in truth is a sort of slightly radioactive material that allows them to map your organs. In general, it's for tumor search. So in this case, the idea is that with this device, probably we could reduce a bit the invasiveness of this kind of surgery. So this was the main goal of this kind of new system, let's say.
We talked before, I should disclose that, in the context of ATTRACT, because we are doing a socioeconomic research on what the engineers in ATTRACT are doing. And I came to you and I asked you the question, did you consider the diversity of human beings in your research? And perhaps you can tell us what happened after.
So I said yes, because I feel someone that is sensible to this argument, honestly. But then in our discussion, I realized something interesting, that sometimes we have an involuntary bias in the things. I think this was very interesting for me. And this comes in our discussion, as we said that in general, one perceives themselves as a whatever human being, and so think that what you could do is good for everybody, and this is not true. This is exactly not what diversity aims at. And it was interesting because then we start realizing exactly that is exactly the other way around. So try to understand the problem and the things that somebody that is not exactly like you. Well, let me make this simple example, because what we discussed now, for this device, we want to try different shapes and different kind of things. So we include also some project of students that bring us a lot of an interesting idea. They produce a mock-up. And then in the discussing already with you, we come up with the fact that the dimension of the end are not the same for everybody. So we should have taken this into consideration. And it was nice because the first surgeon I contacted was a female that look at the stuff and say, no, none of this one is good because they do not fit our needs. And for me, it was a sort of epiphany and say, look, so what we discussed with Claudia is a fact. It's really important. And for me was very interesting because in the end, this brings something into the project. Okay, so now that we're also discussing with a designer, an industrial designer, to have an ergonomic shape. Clearly, these are all aspects that we really flatten down in our request to him, because this is exactly the kind of thing that people, that let's say that in general, we overlook.
What would you say changed now in the design of your medical tool? Perhaps you could even describe how it looks in general and how it changed because of your other view on it.
Well, the idea is that in the beginning we want to stay simple, and you just basically accommodate your electronic and your thing in a whatever shape. The moment that you can keep in your hand seems so fine, whatever. But then when I hand over to this female surgeon, immediately for them was not comfortable. So this means that in this moment we are trying, for example, to slim down the part that should be taken into the end. Also, the weight is relevant. We are working a lot on the fact to be something lightweight, but the distribution of the weight, the ergonomics overall has to be important. It's part of the game. And also in this case is the fact that you need to really have a way to make it extremely comfortable also for small hand. For example, also seems a stupid things, but the position of button you want to put also depend on the size of the hand. So now we are trying to understand which is the best way to accommodate small hands and also larger hands. These are things that makes then the engineering a little bit more complex. So clearly the main goal was that one, also because it was interesting looking at some statistic, and this type of surgery, especially for what regard cancer of the breast and things like that, you have a majority of female surgeon. At least I found that in the hospital between Geneva and Bern, there was a majority of female doctor. So this was interesting to me.
Fascinating. I'm very happy that you were happy with our question and all that followed after. If you would now zoom out again, what is your major driving force to do this kind of research? And what would be the coolest result to achieve?
Well, clearly, the work I choose is because you can exercise your creativity. That's what I like most of my job. So you can think about a new measurement, think about a new instrument, think about a new thing, and this is always every day. So that's what I like of my job. I'm fond of my job. It's not a job for me, okay? It's having fun at work. But clearly, at certain age, you start a little bit looking back and the impact you had around you, and you realize that things are extremely important, but at the same time are quite indirect in the life of the people. So I start looking into medical physics. That for me was interesting, also because as particle physics is quite natural. And the idea is that can we do something? Can we do something better or new that can help really the health of people? So we start from 2018, more or less, thinking about it. 2019, we had the first idea that we already proposed to attract, and luckily they give us some money to elaborate it. And the idea was really to work on something that, we start with something more ambitious, but I say, no, this is too long a run for me. Let's see if we can do something that in 4 or 5 years can go on the market and do something. So we steer a little bit the project, and we start tackling this breast cancer and lymph node search. That is something that is done extremely frequently for the search, because this is not just for cancer treatment, but also for diagnostic, then it's relevant. And so we start moving in this direction, and then we try to be quite fast. For me, the goal would be that if I have, 10 people that use my device and we identify something and this can improve their health, and then I will be happy, honestly. So it's not about money, not about whatever. It's really the possibility to use your skill, your intelligence, your know-how to do something good for people around you.
That's very nice to hear. If you would now consider the experience you had with considering the diversity of human beings in your research, do you think you could follow this up in future projects as well?
Well, this is clear. I told you, I thought always to be someone that is very, how can I say, sensitive to these things. I realized that is normal in my life, my relation, I am, but in my research, I was not. Now, clearly, this I told you. Once you become aware of it, this is a big impact for many things. For example, also now in terms of scan machine and things like that, we start to look if the performance can be tackled for diversity because it's a fact. Diversity does not mean men, women, and this kind of thing. But for example, one of the things that's becoming more and more complicated is obesity, for example. And for diagnostic, this is a big deal. You know that, for example, in countries like in US, already is becoming complicated because the actual scanning machine do not reach the same performance because people suffer of obesity. And so this is another thing that, for example, we start looking also on ourselves because we also in this case, we target the average kind of people. The question is that can our device now also work for this kind of people? So we are now looking also in this kind of aspects. So I think that in general, especially in this kind of field, I'm being more and more involved. This, I think, is extremely relevant. But I think it's in healthcare. Diversity is one of the key. You cannot do without, honestly. I mean, this is extremely relevant. So the moment you start to dealing with health of person, of people, then you need really to have this as one of the key points that you need to address.
I'm so very happy that you stress the fact that diversity is much more than men and women, but also the different shapes of people for whatever reasons. I mean, it could as well be the height or whatever might play a role in health applications. If you would have to advise your colleagues in physics and engineering on how to look at their work from a diversity angle, what would you tell them?
Well, I told you there is no universal approach here because really the kind of technology engineering you're dealing with change. So as I told you, for health, it's evident, and then this is the approach you should try to use. But in general, whatever comes to people has to take this into account. I cannot propose in general an approach. I think that is more relevant than what we just discussed. So the example that we bring together. But people, what I would tell people, try to see which is your unconscious bias. So probably this can come really with discussing with people or involving people or working with people that has diversity, because it's being an unconscious bias sometimes is difficult to catch it. So I would really think that what was done for Attract, for example, could be extremely useful in generally large projects. For example, in all European project, whatever, a request to address the how diversity enter in your project and which is the thing that you think are relevant could be important to have people start looking into it. Sometimes people perceive this as just, it's just another question I should answer. But I'm sure that this aspect, this instead can be well received, honestly, because it's about people. So I think it can be useful. So among all the things of a project, goals, money, and things, and then how diversity, or might be in some cases diversity is not relevant, but at least you should think about it and see, is it or not a fit? And in case it is, how can I tackle it? Because I think this is the thing. I told you, for me, this was now the change of attitude I have now.
And would you rather involve social scientists like us to figure this out, or would you rather ask, for example, patients or surgeons, like in your case, to figure this out, because there are different ways that might help you to have a look at diversity and potential impacts that this aspect has on your research and innovation?
Well, probably there is not a single way to do that, and depends on the phase of projects. For example, I think that when you start for an idea or to formulate a project, probably you need then in case to receive input from, I don't know, the surgeon, whatever, but in case also to involve people like you, because I believe a lot in the multidisciplinary, because sometimes the dynamic for yourself. I mean, I like to also have a different mental approach to things. So people that come from another field sometimes can really bring you something. So probably in that phase could be extremely irrelevant. Clearly, when then you start to approach more and more the final user and the patient, this can also be another question. It's not that trivial because, for example, especially in project like this one, you can never approach patient. And I think it's correct. I mean, protocols are exactly try to protect the people. But the question can be that you can have also personal relation with the people that has the problem, and then it's important to try to deal. But I told you, accordingly, all of the things that you mentioned should enter, and each of them in a different moment of what you're doing.
Absolutely fantastic. Given our conversation, is there anything you would like to add, which I forgot to ask, basically?
Well, I don't think so. Also because, I mean, we discuss intensively, so I don't think being repetitive here, it's relevant. The only thing really that for me was extremely important to have this input. I mean, when we start discussing, it was just, okay, let's do this because we need to do that. In the end, turns out instead of something that really brings something to me. So I just want to encourage all the scientists, young scientists, to be open-minded and be involved in other disciplines, in discussion with other disciplines for the research, because this can bring something good for them, their life, their career, their interests, their creativity also sometimes, you see.
And the people they are serving, basically, which you were pointing out a bit earlier on, which I find really nice because I have been talking within this ATTRACT project to quite a number of physicists and engineers, and almost everyone was very driven by the fact that they want to help people. It's not about money, like you said. It's not about, doing something for yourself, but it's really for in the interest of serving people, and that is so very nice to hear. So thank you once again for contributing to our podcast series on inclusive research and innovation in science, technology, engineering, and mathematics.